I'm here today with Nem, and Nem has asked to be anonymous. And like so many people, I think that's because of the backlash that can occur and the judgments that sometimes happen for people who speak out about their experience in this transgendered moment that we're having. So, Nem, I know very little about you other than that you detransitioned. Can you tell us about yourself?
Yeah, so I'm 20 and I got diagnosed with autism when I was 19, and I actually got diagnosed through the gender clinic.
Oh, wow. So you
So,
went to the gender clinic originally to get treatment for gender identity issues,
yeah,
and
and
they diagnosed you.
yeah, I was suspected by other services because I'd been to, I don't know if you know what CAMS is in the UK. It's like, yeah, I went to CAMS and they kind of suspected I might be, but I aged out of that, so I never got assessed because there's different ways to assess autism in children and adults.
Okay. So for
So,
those who aren't familiar with the healthcare system there, can you just give us a little bit of an overview?
okay, so when it comes to mental health services, there's a separate routes for children and adults. So if you're under 18, the only people you can see unless you're seeing private therapy is CAMS.
And they felt like it was appropriate to refer you for gender identity issues to the was it Tavistock or
No, I went to Chalmers in Edinburgh,
okay.
which is because Scotland has its own NHS.
Okay.
Um, so I went to Chalmers. There's two clinics in Scotland. There's Sandyford, which mostly deals with under 18s and adults in the West Scotland area, and there's Chalmers, which is East Scotland and usually only deals with adults.
Okay. And so you were how old when you first went there?
When I first went to, do you mean CAMS or Chalmers?
Probably both.
Oh yeah,
Yeah.
CAMS I started seeing when I was about 15,
Okay.
and Chalmers I saw when I was 19.
Okay. And
So
did you go there specifically to get treatment, to get transitional treatment?
I'd been seeing CAMS before because I was having issues with depression, and when I was about 16, 15, 16, I started to consider transition.
So it's in your case, it's unusual because most of the people, especially the young women that I've talked to, have kind of gone through transition and then been diagnosed with autism. Whereas it
Yeah,
sounds in your case it was different.
yeah, which I think is kind of a good thing because in my experience, I think they did everything right. Um, well, because I think part of it is when you're speaking to these services, you have to be honest about anything that's in your history, and they were very good at screening stuff as well. Like I went through a sexual assault when I was 16, and that got flagged when I went up, and they were very sure. They made sure that I was getting a trauma therapy and stuff like that, which I feel like some services who are more busy, especially Tavistock, because they're really busy. They have a massive waiting list, and I think they're just trying to get through as many people as possible. And I don't think they really think about checking for stuff like that.
Well, and in the US, actually, there are some states where it's illegal for therapists to sort of pursue those avenues because of therapy bans. And so it sounds like um, I'm really impressed that you actually got that kind of care, especially because we know that sexual assault is one of those indicators that um, can kind of push young women, girls and young women, and probably even boys and young men into a gender identity crisis.
Yeah, for sure. It definitely contributed to me. I mean, I've always had these feelings. I think some of it comes with being autistic because autistic people kind of, you can fall into black and white thinking and not understand like gender roles, if that makes sense.
Well, and if you're anything like most autistic girls, you kind of don't get the whole culture of girlhood, I guess is
Yeah,
what I'll call it.
yeah,
Um,
100%.
yeah, that you sort of feel like an outsider anyway, and your interests are tend to be more aligned with what is traditionally male interests. And so if you already have those inclinations and then you have that black and white thinking, it's not surprising that you might conclude that you're a boy instead of a girl.
Yeah, that was definitely the case for me. And also there's gender dysphoria has a lot of similarities to sensory problems, and autistic people can struggle a lot with puberty, which for me, I really did not like puberty. Like physically, the physical experience of puberty was quite distressing
All
to
those
me.
changes. Well, and that leads me to something that I've had sort of a hypothesis about for a while, and that is people who are autistic often benefit from compression therapy. And I almost wondered if breast binding might be a form of compression therapy. And so a girl who is autistic and feels like she's a boy and then binds her breasts might feel comforted by that simply because of the compression.
Yeah, I honestly think you might be right on that one because I remember when I was thinking about stuff, I thought, oh, I'll buy a chest binder and I'll try it out. And I really loved wearing it. I felt so much more comfortable wearing it. So I just thought, okay, I'm on the right lines here, you know?
Right, because I know they even sell compression vests for children and teenagers, and probably adults who are autistic, because that feeling of compression is really comforting. So you actually, how long did you bind for?
I binded for about 2.5 years. Um, I did enjoy binding while I did it, but there I had to stop because it began to get quite painful.
Yeah, I was wondering if you had any sort of negative consequences from binding, because I've heard some girls talk about even getting lightheaded, having difficulty getting enough oxygen if they bind really tightly.
I was good in the sense that I made sure, because there's different ways to bind. You get like ace bandages, and then you get ones that are specifically designed for long term. And I wore one of those, so for the most part it was okay. But these things are you're not supposed to use them long term, if that makes sense, and you're not supposed to use them all day. And I feel like sometimes when you feel that way, you won't take it off, if that makes sense. You'll
Yeah.
just leave it on all day.
Yeah, and it makes sense. I know that, if you're feeling something that is comforting, it's hard to take it off.
Yeah.
I've even heard of girls who sleep in them just because,
Yeah,
um,
I definitely did that a few times, which is it's actually very dangerous to do that. You're not supposed to do that. You can get tissue damage and
right.
stuff like that. But
So, when you went to the gender clinic, it sounds like they did an initial assessment and diagnosed the autism, and then did they refer you to somewhere else, or did they continue working with you on your gender issues?
well, what happened was they didn't do an automatic screening. I went there and we talked about they go through your childhood experiences, and basically they can't approve transition unless you have evidence that it existed in childhood.
Oh, interesting. So that's radically different than what's happening
Yeah,
in the US.
yeah, which I think is really smart. One thing that really disturbs me about the system in the US is you can just walk in and get hormones. That's not
Yeah,
possible to do
it's
in
incredibly
Scotland.
easy. Yeah, so that's really good. That gives me hope.
Yeah, and they also don't assume that transitioning is right for you, because they're starting to understand that there's different presentations. Like before they were like, well, you're either trans or not. You're either gonna go through a full transition or not. But now they're more considerate of non-binary or gender non-conforming people or questioning people. Like
Well, and
anyone's allowed to go.
that's really good, because I think that there is some important nuance there. I'm probably significantly older than you, and I have to say that I still to this day do not feel like a typical woman. And
Yeah.
I don't think I ever will, which doesn't mean I'm not a woman. But if I went to a gender clinic in most places in the U.S., they would push me into believing that I'm transgender rather than help me to sort of accept myself as a non-gender conforming woman.
Yeah, I think with the clinic I went to, they weren't pushing you any one way. They made that very clear. They just wanted you to have a better view of your own sense of gender or self.
That's
Lack
great.
of or yeah,
So
it
do
was
you,
really surprising.
Yeah, and so did you leave there, or I don't know, maybe you're still seeing somebody there. Do you categorize yourself as gender nonconforming or non, like what is your sort of way in which you view
Um, I I don't really label myself anymore because I
yourself?
find sometimes they can be you can kind of put yourself into a box with that. I know I'm female and I'm fine to describe myself as a woman, but I don't really identify with anything. I just feel like more of a human.
Exactly. This is sort of who I am, and yeah,
Yeah.
I like that too. I'm a human being, and I know based on my chromosomes that I'm a female, and any further than that, I don't know is particularly helpful.
Yeah, I feel the same way, and I think people can get into the trap of it's kind of like you have an idea of what a female or a woman's supposed to be, and if you don't fit that, you'll start calling yourself something else, and then you might start judging yourself through that lens. And I feel like a lot of people do that,
So, just out of
just generally.
curiosity, were you disappointed by their approach initially? Because I know that some people go in and they're sort of gung ho about, getting on started on the medical transition.
Not really, because I was just happy to be there because the waiting list for these places is extremely long. Um, I was lucky that mine was like a year, but I'd actually tried to be referred to Sandyford, and that kind of fell through because it wasn't done properly. So I had to wait even longer. It took me almost 4 years to see anyone
Wow.
about it, which is during that time I actually considered like black market hormones and stuff like that. So I do wish these services were a lot faster than they are.
That's really interesting because there are pros and cons to waiting. Some people, if they wait, then their gender issues resolve. But as you said, some people, when they feel like they have such a wait, will go to the black market. And my understanding is it's not very difficult to get hormones on the on the sly.
Yeah, in the UK, it's actually illegal to buy black market hormones. You can get it through the NHS, but to get it for any kind of gender thing, it needs to be through a gender clinic. But you can get it on the black market if you have any understanding of computers, basically.
Well, and in the US, I don't, there are so many places where, I can just log in and buy them. And I don't know that there's any laws. There probably are some laws, but it's so easy to get. Um, and most kids are pretty computer savvy. If they want something, they'll be able to figure out how to get it.
Yeah, I don't think that's a good idea because then anyone can just take it. And also taking testosterone. I know you get the gel, which is different, but you need to inject yourself for most testosterone, so it should really only be done by a professional.
Yeah, and that's something. I talked to Sydney Wright, who was prescribed testosterone, and her doctor didn't even show her how to inject it. And it turns out she had been injecting it wrong and had some really serious complications as a result of it.
Yeah, that doesn't sound very good. I think the way things are in the USA kind of disturbs me a bit because I think it kind of sullies the reputation of um, gender clinics who do things right.
Yeah. So are you still going to the gender clinic?
No, I actually stopped going because I think when I found out I was autistic, because I'd suspected myself for a while, but when I actually got the diagnosis, it kind of just made more sense to me why I didn't feel any kind of, sense of gender fully, and it kind of resolved.
So for if you could give advice to girls who are potentially autistic and having these feelings of gender confusion and not feeling like they fit in, what advice would you give them?
Well, I'd say to anyone who's curious if they are in the spectrum, there's screening tests you can do online. The autism quotient, it's not a diagnosis, but it is a good indicator. And I think if you score high on one of those, on the autism quotient specifically, you should probably see someone. And the gender clinic were clear in that they like people to get assessed for things like autism before they go through any kind of transition because autism affects your sense of self because you have different brain wiring basically, so it's going to affect your sense of self, so it's good to know about. And also there's issues with people masking. Most people probably don't know what masking is. It's kind of something autistic people do to fit into society, but it can cause identity issues if you do it for too long because you can kind of lose your sense of self.
Can you describe that a little bit?
So masking is kind of autistic people kind of have sensory urges like stimming or may exhibit like inappropriate, sorry, social behaviors and stuff like that.
Yeah, I definitely relate to that. I know that even now I feel like I don't quite, it's funny because somebody asked if I ever felt like a fish out of water. And I always say, I don't even feel like a fish, you know?
Yeah, that's very common for autistic people to feel like kind of like an alien that's just landed on Earth,
Yeah.
and you have to try fit in, and doing that can have identity issues because if you're trying to suppress yourself all the time, you'll kind of build up a persona.
Oh, that's so interesting because yeah, and if you're trying so hard to fit in, because one of the things that I did as a little kid is I used to watch the boys, and it was almost like I tried to be a boy, only more a boy than even the boys were, just to show that I was a boy. Is that kind of what you're talking about? Is that sort
Yeah,
of taking information in and trying to, because you don't feel like you fit in, trying to copy other people's behavior?
yeah, and that's very, very common in female autistics specifically. They call it mimicking behaviors because autistic people don't have that socially innate sense of um, social situations. So you have to learn. Like it doesn't come naturally to you. You have to observe behaviors and figure out what's appropriate and what's not. If that makes sense.
Yeah, that really makes sense. So can you describe your childhood a little bit? Because it sounds like it must have been confusing.
Um, well, I'm a twin, so for the most part, it was good in the sense that I had a twin to kind of observe because she's not on the spectrum.
Oh, wow.
So if I was confused about something, I'd just, see what my twin is doing or see what other kids are doing. But my childhood, for the most part, was quite good. I was raised Catholic, which I think kind of caused some issues because I think, um, I don't know, with being raised Catholic, sometimes there's a sense of guilt about being female sometimes. I think there can be that narrative in some communities or even like subliminally. So I think that did cause some issues. But overall, my childhood was good. My parents divorced when I was 8, and I think my early adolescence and teenage years were not good, I'd say.
Well, and then it sounds like you had a sexual assault when you were young too.
Yeah, yeah, I was 16. That was actually what they call, people call it corrective rape. I wasn't
Oh,
raped, but it happened because I told this person I was having gender, you know, incongruence feelings and that I felt like I was asexual. And this person, who was probably my only friend at the time as well, felt the need to, assault me,
oh my gosh.
to
That's
fix
just,
me. And that, yeah, that was very traumatic, I'd say. I
wow.
was lucky that it didn't go as far as it could have gone, but it definitely stunted me mentally for a while.
Well, and especially if you're anything like those of us who suffer from confusion about social situations and trust and friendships, to have your friend do that to you, it just seems like such a violation.
Yeah, it was definitely it was confusing for me because I wasn't a very sexual person at the time, and I think because I'm autistic, I can overlook some red flags, if that makes sense. Because I kind of try to assume the best in people, and I kind of overlook some bad behaviors as, oh, it's just temporary, or you know.
Yeah, you don't have the if you're I have this gullibility that I have. I call it gullibility because I can't read people if they're whether they're safe or not. And I tend to just believe what people say. Is that kind of how you are?
Yeah, that's very common in autistic people as well. It's just this kind of people say it's naive, but it's more you struggle to read people's intentions, if that makes sense. So you take people very literally and can miss when people communicate, they can say one thing but mean another thing, or and for autistic people, it's hard to figure that out.
Right. Which is it's so interesting because I get teased a lot, and I think it's because I don't I don't really catch people's humor sometimes, and so somebody will say something that's sarcastic or a joke, and I will take it seriously and kind of be shocked while other people are kind of laughing at the joke and laughing at my response.
Yeah, people usually say autistic people are like the last one to get the joke, and I definitely found that in some cases I was.
Yeah, I don't know. Every once in a while, like it'll be years later, and I'll finally get a joke.
Yeah, I had that. I took a lot of words literally. Like when I was a kid, you know how you have the term rock star.
Huh.
For years, I thought that was just a star-shaped rock.
Oh, right.
Yeah, for years, I was, in my late teens before I was, and figured out about metal music, and I was like, oh, that's
Oh,
that's what people are singing about all the time.
that's awesome. So do you feel like you're negotiating your sort of experience of being a woman now that you're older? Do you sort of, does it make sense to you, or do you still have feelings of dysphoria?
I do sometimes, but I've kind of, through various experiences, learned to kind of remove the kind of social aspect of it, because if you think about that, it's you can run into the issue where your sense of identity isn't coming from yourself, it's coming from other people, or a mask, if that makes sense. And autistic people are very prone to masking, so I try to avoid that.
Yeah, I think that that's it seems to me like also a big problem with the younger generation. And I don't know if it's due to social media or if we are just having more kids who are on the autism spectrum. But that tendency to mask, as you say, I think is increasing in the younger generations.
Yeah, I think it's a mix of both, but I definitely feel that nowadays, especially young teenagers or tweens, are kind of forced to sexually mature a lot faster than they would, and that if you're not getting into that stage, you'll probably be shamed for it.
Yeah. And how did your family handle your issues? Were they supportive? Were they encouraging you to believe that you were born in the wrong body, or were they just concerned about your sort of your issues?
They're mostly just concerned about it. They didn't push one way or another, which I think was very helpful. Um, I remember my dad saying, "It's fine if you feel that way, but you're not Popeye," because I was in a pub with him, and I was like, "Okay, Dad," and they're all generally very nice, and I feel like that was helpful because I feel like if you're rejected by your family for feeling that way, it can kind of push you to go the way you were already going without you know examining yourself fully. You can kind of feel rushed just to prove a point, if that makes sense.
Yeah, I think that having, from what I gather, that kids who have a parent who doesn't affirm them, but also doesn't shame them and doesn't judge them, tends to be a good approach.
Yeah, for sure. And I'd say also recognizing that certain behaviors, if your kid likes wearing, typically male clothes or playing with boys, that doesn't necessarily mean that they're going to end up being trans, and it's not necessarily a bad behavior either. It's just part of what they like.
Yeah, it's interesting that we've pathologized gender nonconformity.
Yeah, for sure. And I feel like that's sort of the case, like because you feel masculine or feminine, sometimes people say, well, that must mean you want to be a male. But I think they're kind of distinct.
Yeah, and it seems like we need gender nonconforming women as role models, and if they all decide to transition, then there won't be those role models.
Yeah, for sure. And there's definitely not that many gender non-conforming women in the media. Like I didn't see anyone like that at all. Basically, these people are usually made fun of. I know when I was a teenager, I was definitely bullied. I was called the D slur, because I wasn't gay, but I wasn't feminine,
And so
and
the assumption was that you were a lesbian.
yeah, and I was definitely bullied about that. I was even called a pedophile and stuff like that. Yeah, it was quite severe, and I think that's a problem that I do find in the UK as well. that they're not very accepting of gender non-conforming people, like especially teenagers, but that might just be teenagers in general.
Well, and it sounds like they're not very accepting of homosexuals either if they're using those as slurs for somebody
Yeah,
who's
for
gender
sure.
non-conforming.
Yeah, for sure. Especially in the high school I was in. I know it's better nowadays because they've brought in LGBT acceptance programs, which has helped it. I noticed in my latter years of high school that sort of bullying kind of died down a little, which is a good thing. But I think it can be pretty damaging for people who are um, just don't behave fully masculine or feminine to be bullied like that, because then you might think there's something wrong with you.
Well, and it's interesting to me because when I was a kid, I was called a faggot, which I don't hear that term anymore. Um, but it's interesting to me that all those years ago, that was a, considered um, awful thing to be. And now even all these generations later, that kids are still being called names based on someone's presumption of their sexual orientation.
Yeah, I think it's pretty damaging. I've never heard someone use that term with a female before.
Yeah, it's funny. That was and I don't know if it's, if it's regional, but I was definitely called a faggot. That was sort of, I don't know that the term lesbian and butch lesbian and dyke, I don't know that those words were really um, very common when I was growing up. Um, and so it is kind of, well, and the other thing is I presented as a boy, and so it might have been part of that sort of, they were trying to figure out what to call me
Yeah,
because
yeah.
I
Maybe
was
they just thought, yeah, maybe they thought you were male already or something.
exactly.
Yeah,
Well, and it is that bullying can be so damaging, and it's interesting to me that children start to bully other children based on sexual orientation, when children shouldn't really be even thinking about what sexual orientation they are.
yeah. I kind of agree with that. I think there's too much focus on um. Well, I just feel like kids these days sexually mature a bit too fast, and I think there's a lot of pressure to do that, even if people aren't ready. I feel like, it's good that people are accepting of different sexualities, and that's great. But at the same time, there's also this kind of pressure for people to behave in a sexual way, if that makes sense.
Yeah, and it actually, I wondered about that because just as with any kid who's gender nonconforming, who is now sort of labeled as transgender, I wonder now if kids who are just sexually experimenting are going to be labeled as, whatever sexual orientation they're experimenting with, when in fact they're too young really to have that sense of sexuality.
Yeah, for sure. And I think sometimes not choosing a label is good when you're questioning, because you don't want to, give yourself like confirmation bias basically. You don't want to start looking for reasons to say you're one way or the other. You just really want to be yourself and just let things develop naturally.
I think that's such great advice coming from someone who, I think as someone on the spectrum, it's easy to want to look for confirmation bias, that's sort of
Yeah.
a tendency. So the fact that
Yeah,
you're
for
so
sure.
aware of that, that's amazing.
Yeah, I think realizing I was autistic, because it really does affect your life and how you perceive things. And I remember when I was looking up the symptoms of autism in females, and I was like, it's like reading a book about me or something, it. And I scored very high on the screening test as well. And I was very, very lucky in that they got me an appointment for an assessment very fast. Usually it takes 2 or 3 years. For me, it only took 6 months, which was really good. It was a favor, basically, from my gender nurse to one of the psychiatrists in the clinic, who's they approve surgeries, but they're also trained to diagnose autism.
Wow. And to me, 6 months even seems like a really long time to wait, but I can't imagine waiting 2 years.
Yeah, in the UK, mental health services really aren't very good. They're very slow, unless you have money, which there isn't really much private insurance in the UK. There is for, I think you get Bupa and stuff. It's like this private insurance, but most people just use the NHS, and the NHS is really lacking when it comes to mental health services.
Wow. And that explains a lot because if you don't have someone who can do that assessment quickly, um, it's so much easier to sort of fall into this trans identity. and especially because there's so much affirmation now, there's so much acceptance now, um, that it just, rather than sort of continuing to question, most kids don't have that insight anyway, and then if they have to wait so long to get good assessment, and it sounds like you got it. It sounds like Tavistock might not have been providing that kind of assessment as well, but that kind of information can be life changing, as you've noted.
Yeah, and I was very lucky. Sorry, my voice is a bit messed up today. I just woke up. I always get a croaky voice when I wake up. Um, um, but I was very lucky about it. Because basically in my county there is no autism diagnosis services for adults. So I tried going to my GP to get an assessment, and she just said, "I've tried, and there's nothing we can do about it." So the gender clinic was pretty much the only option I had, and I'm very lucky that they gave me a screening test the same day I brought it up, because I was very nervous about it because I was kind of worried I wouldn't be able to get any treatment or therapy from them if I brought it up. But um, I'm lucky that they just gave me a screening test.
So you've mentioned a few things that I'm thinking about, if there's parents watching this, or if there's kids who are watching this who are not sure if they're transgender or autistic. And you mentioned things like masking, the sensory issues, the black and white thinking, the can you think of any other things that it might be helpful for a parent or somebody who suspects that they might be on the autism spectrum to look at before jumping to the assumption that they're transgender?
Yeah, for sure. I'd just say to them, if you suspect you're autistic, please look up the symptoms and read things from other autistic people too, because I think people have a perception of what autism is. They usually see it as the more severe sensory problems, low functioning, but it's actually a lot more complicated, and everyone's different. Um, and I think there's a lot of similarities between sensory problems and gender dysphoria.
That's a really good point, because that discomfort within the body, um, I still have these things, I want to say self-stimulating behaviors, which if people don't understand the context, they may assume that it's a sexual thing, but
Yeah,
it's not. It's a way of kind of reconnecting myself with my body that I do, and I have a number of them that I don't even realize I'm doing them a lot of times, but a lot of times, somebody might notice, and my relatives and friends definitely know about them. But it's because of that sort of discomfort within the body, and sense of, I mean, I am constantly like readjusting and finding like irritation in a way that I don't think other people do, or most people
yeah,
don't.
for sure. With autistic people, I mean, when I got diagnosed, they said I was strange in the sense that my social deficits didn't seem to be as bad as others, but they said that could be masking. But my sensory issues are quite high, so I do stuff like tapping my hands, I'm walking in circles, stuff like that. It's just like self-soothing behaviors, because if you have sensory problems, it's hard to get comfortable. Like, I don't think you'll ever experience, well, you might at points, but don't expect a full sense of comfort in your body. You're just not going to get that.
And if they're thinking that they are in the wrong body, and that changing to the other sex will bring them comfort, then that
Yeah,
totally makes sense. But it's gonna, I don't know what the hormones do, but they're, initially they might cause distraction, so
yeah.
that you feel a little bit more comfortable initially, but in the long term, they're not going to be able to cover up those other issues.
I mean, they were good with me because they warned me that your hormones can affect your experience of autism. And they told me that the risk with taking testosterone was I could end up having a different presentation of autism,
Oh,
because it could
interesting.
be more like the male type of autism. So I shouldn't expect any sensory issues. If I am autistic, I shouldn't expect any sensory issues to go away. And there's always the risk that I would be more uncomfortable, and also I'd have to take a lower dose of hormones.
What
So
is so interesting about that too, though, is that if taking testosterone pushes you to have more of a male presentation of autism, and you already have a difficult time sort of with that sense of self, then it seems like it wouldn't be uncommon for girls who are autistic to take testosterone, and the testosterone could cause, I don't know, interference almost with their ability to recognize that it's not helping.
Yeah, for sure. Definitely. And there's a lot of
Oh.
even when people take hormones and stuff like that, I think online there can be this kind of echo chamber where it's like it's been the best thing ever, and there's not that much talk about the negative sides of it. Like it doesn't always work out the best for people when they take testosterone. And at the clinic we're very much like that. You can't expect, when you see these people have like amazing, you know, transitions. They look very female and then they look very masculine. Everyone's different. You're not necessarily going to get the results mentally and physically that you wanted.
And it
So
could, in fact,
yeah,
cause, yeah, that's so, I'm glad that you said that because that's giving me something to think about that. Because the other thing is that the male presentation of certain mental health issues and the female presentation of certain mental health issues are very different sometimes. And if we have clinicians that are looking specifically for one and not the other, then that can also cause problems. Because one of the issues I
yeah,
had was that, well, I was younger and I was diagnosed with ADHD, attention deficit hyperactivity disorder. And I was the first girl at the clinic to be diagnosed with that. And they didn't actually think girls had that. And then the autism spectrum was very new. And I didn't get that diagnosis till I was an adult. And it's because girls present differently. And so it could be that, OCD, depression, anxiety, all these things that we sort of have the male research on. And maybe one of the problems is that we haven't looked at female presentations well enough.
yeah, for sure. And that's definitely the case of autism. I know a very large proportion of people that go into the gender clinic also have autism, and that's something that the specialist I was talking to was looking into. I think they might start screening for it before, which I think would be very helpful because whether someone goes to transition or not, you should know about that first, and that's something they should deal with way before you think about transitioning because, finding out you're autistic is a big thing.
Well, and getting through puberty, those are two
Yeah,
things that I think are really critical because
yeah, of
puberty in and
course.
of itself is so hard. And then autism is, it kind of separates you from the rest of society. And if you combine those two, um, I just feel like it's so important to kind of get those issues resolved before. And again, that means waiting until adulthood to even explore the possibility of medically transitioning.
Yeah, for sure. I feel like there's a problem with people kind of jumping the gun, especially like I didn't really sexually develop until I was older. People that have autism, they're sometimes delayed, both socially and in terms of their like sexual sense of self. I was asexual pretty much till I was 17, and I kind of thought maybe it's because I'm trans, and um, not in the right body or whatever. But as I got older, I kind of developed a bit more mentally.
Wow. Yeah, that's interesting because I actually had this. This is kind of embarrassing to admit, but I had this epiphany with multiplication that I was really bad at math, just horribly bad at math in elementary
Yeah,
school.
me too.
Couldn't remember my multiplication tables to for the life of me. Couldn't, and it wasn't until I was in my 30s that I finally realized that you could play around with numbers in a way to, like, if you had 31 times 10, that you could do 30 times 10 and then 1 times 10 and then add them together, and like simple things like that just it's sort of like breaking out of sort of rigid thought patterns, I think.
Yeah, and I think autistic people definitely uh, struggle with that. You can get kind of like a one-track mind, and I think it's always good to wait and see if your perspective changes. Also, I think there's a lot of focus on passing and the benefits of passing, but I kind of have some problems with that because um, I think people should be treated with respect, whether they, no matter how they look, and I think that's the problem because people judge gender non-conforming people, say if there's someone wearing clothes that aren't for the, typically for their their sex. And I just I don't like the idea of saying because you wear something or because you behave a certain way that means you must want to change your sex.
Well, and that's one of the issues that I have about the gender ideology right now is that there are women who aren't attractive and they should be accepted. And there
Yeah,
are men who are going to be pretty and they should be accepted. But it's almost like now I get the sense that it's not okay to be an unattractive woman and it's not okay to be a feminine looking male. And it bothers me because we're judging people based on their looks so much rather than on who they actually are.
yeah, and I feel like that's a problem because some people like this may feel like the way for them to be accepted is to transition, and that's not really. I don't think people should transition for reasons like that because that's kind of a neurotic reason
Yeah, and
to
that's
do it.
where I've actually, when I talk to plastic surgeons who are concerned about this, usually what they say is that, they'll perform surgery on someone who wants to, change the way they look if the person is very aware that it's not going to change their life. It's not going to
Yeah,
change who they are. It's just going to maybe make them feel a little bit more self-confident or something. But if somebody comes in and says, I want this nose job because it will change my life and I will be more successful and I will get more dates and have a better job, then the surgeon is like, whoa, this is a different issue here and this person needs psychiatric care rather than surgery.
yeah, for sure. And I think maybe there's some situations where transition is appropriate, but I feel like a lot of people can do it for neurotic reasons, and that should really be screened for more. If you're trying to turn into someone, that's not a good reason to transition because you should just be yourself.
Yeah. Well, and it's really it's disappointing that it's so hard for people to get good mental health services. And I've actually even there's some therapists that I've heard like Sasha Ayad who's in this field and working with kids and who suggested that maybe you shouldn't take your kids to therapists anymore because therapists have this sort of one track approach that if somebody has these gender issues, they're transgender and they should start transitioning. And I think your story is so important because it shows that that's not the case and that in fact it could lead someone down the wrong road.
Yeah, for sure. I mean, I'm diagnosed with gender dysphoria, gender incongruence, and I'd say you can be diagnosed with that. That doesn't mean you have to transition, and that doesn't mean it's necessarily the right choice for you. Just, people should be aware of that.
Right. And that there are ways to manage it because
Yeah,
um, that's one of the things that I think that is important for anybody with any kind of body dysmorphia to realize that, there are techniques that you can learn to help yourself manage it. It may not completely go away, but that, it's sort of a story that you tell yourself. You can tell yourself that you're born in the wrong body and that you should transition, or you can tell yourself that you have these feelings of incongruence or dysphoria and figure out how to manage them.
yeah, for sure. And I feel like there's a problem now, and I'm lucky that in Scotland, they're kind of being more open to gender non-conforming people and non-binary people. This kind of idea that you don't necessarily need to get a sex change
Yeah.
to feel better about it. Sometimes it just takes some like self-acceptance of certain behaviors and stuff like that. If you like masculine things, that's okay. It's okay to do that. That doesn't, you know, I feel like some people want to transition so they can then be stealth and not face the backlash that people get for being gender non-conforming because I think that'll fix all their social problems.
Which in a way is really understandable, but it also ends up promulgating the problems that they're trying to avoid.
Yeah, for sure. And I'm glad at least I feel good about saying if anyone's in the East Scotland area who's 18 plus and wants to see a gender clinic and you're questioning, they're not going to push you anyway, so don't be afraid to go.
That's really good. And hopefully we'll find other clinics. We probably, the last guest that I talked to, Alex, is putting together a map of gender clinics that have done really bad things. Maybe we need to start compiling a list of gender clinics that do good things.
Yeah, for sure. I mean, I've heard a lot of, bad stories from gender clinics, people just going on their first appointment, they're given hormones and stuff like that. And there's absolutely no screening involved. There's no talking through past experiences. It's just, here's a prescription, which doesn't really solve anything because it, it's kind of like with depression and stuff, sometimes they'll just give you like Prozac or something, but sometimes, your issues can be very much like psychological. You might have like trauma or things you need to work through for it to be better. Sometimes just like medicating doesn't always help things.
Well, and in fact, it can often cover up issues,
Yeah.
and so they'll end up bubbling up in other ways. Um, and my hope is that people who do have issues like autism and sexual assault and other things that have caused them distress, that they're given the opportunity to work those through rather than cover them up and try to run away from them.
Yeah, for sure. The client were very helpful for me. They referred me to a sexual abuse survivor charity that does therapy. So I started getting weekly therapy, and they said they wanted me to work through that. I got the autism diagnosis, and it's a shame because there isn't many therapy services for autistic adults. It's kind of you just get the diagnosis. There's not really much help after that, but it's still good to know. And I got a lot of help in college as well.
Oh, that's
Um,
great.
so, because before I was dropping out a lot, I couldn't really stay in college, and last year I got an A, so that was
Oh,
good.
well
Yeah,
done.
yeah, I went from flunking to getting an A. It was great.
Well, if it makes you feel any better, my first year in college, I had a .00 GPA. I failed every single
Oh
class.
no. Well,
But
I'm
when I
just lucky it's
finally,
in Scotland
yeah.
because Scotland's free, so I don't need to pay any money because I think it'd be very upsetting to be an American and have to pay for it.
Yeah, it was a little disheartening, and yeah, it's one of those things that I look back on and I can't figure out how I did that badly. Like, not doing well is one thing, but completely failing everything.
Yeah, I just feel like sometimes people aren't in the right place for college, and there's a lot of pressure to go on to education um, earlier than some people might be ready for.
Well, and it sounds like you've done a lot of maturing, and I'm really excited about your future, and congratulations on sort of figuring things out and doing well in school.
Thank you. Yeah, I definitely have a better life now.
That's great. Is there anything else that you wanted to talk about before we end the interview?
Um, not not really. I just want to say to people, take your time with things. Don't rush anything. Also keep your head out the echo chamber. You don't want anyone telling you one way or the other. If someone's saying, "Oh, you're not trans," like trans is fake, you're disgusting, you're degenerate. Don't listen to that, and also don't listen to people saying, you are, this is, your fate or whatever. Just take your time with it.
Yeah, I
Don't
like that. Take your time and listen to lots of different sources.
Yeah, and also I'd say wait, like if you're, sometimes when you're a teenager, it can seem like, you have to do this, because well, a lot of people they say, the longer you wait to go on hormones, the less benefits you'll get. You won't end up being as tall.
Mm.
You might not have as deep a voice, but I'd say especially for well, just across the board really, it's not reversible. So don't treat it like it is because it's, um also, if you do decide to take hormones, take a lower dose to start with. That's what they do in Scotland. They don't put you on a high dose
Oh, wow.
initially because they, once you have the effects, sometimes they're irreversible. And if you don't like it, you're stuck with it.
So, just out of curiosity, what do you think makes Scotland different than so many other places? Because it sounds, when you talk about it, it sounds like there's so much more nuanced in their approach than they are here in the US or in New Zealand or Australia or in England, even Sweden. I mean, all these other places, it seems like, have such a different approach. So, do you have a sense of what it is about Scotland that has caused it to be have such a better model?
Yeah, I feel like with Scotland, they have good funding. I'd say the way the NHS is structured in Scotland is a bit different from England, and also, um, they they kind of listen to different views. They're not just looking at the success stories or stuff like that. They're they have like a panel, you know, they all meet and they all discuss things and treatment options and stuff like that. And it's nice to see that they're kind of moving on from this very strict binary view of things. I feel like that can be a problem sometimes because they just think, oh, well, if you're trans, you go on hormones, you know, that is the one treatment for it. Whereas in Scotland, it seems to be a bit different. You know, they still recognize that you need like therapy. You need to talk about it. It's not just a hormone thing.
And
And
it
I feel
sounds
like
like,
other places, yeah,
yeah, they
other places don't do that.
yeah, they have the sense of, you know, what those red flags are that can um, trigger those gender identity issues.
Yeah, for sure. It was definitely flagged for me. I think it was the second time I went because they have to. If they don't, they would probably be accused of medical negligence because they have lists of things that have to be flagged if you have any history of it. And sexual assault is one of them.
Wow.
And they they won't force you to get therapy for it, but they highly recommend it.
Yeah, and see, here in the U.S., they don't do that. I have not heard of any of that. That you know, kids will go in and their first appointment, they'll get a shot of testosterone if their parents are there with them, without looking at any of this previous history. And I've had parents talk to me, and they've begged therapists to look at the fact that a child has sexual assault issues or has an eating disorder or autism, and the therapists don't even look at the history.
Yeah, that's definitely not a good thing. And I'd say in Scotland as well, they're also very clear on the risks of things. Like they talked to me about hormone blockers, and they weren't like, "Oh, it's great because you know you can sort of post puberty." They told me about like all the risks with it, and it seems like they don't. That's not their first point of call, you know. So they will try to avoid blockers.
Which is good
Um,
because those
yeah,
really those can cause so much harm.
yeah.
But yeah, well, I'm really optimistic that you had such a good experience, and that there are clinics out there that are doing it right. It sounds like.
Yeah, for sure. I mean, I had a great experience. It definitely changed my life for the better. You know, I didn't feel pushed, and it just helped me resolve things.
Well, thank you so much for sharing your story, and I just wish you all the best.
No problem. Thank you very much. I
Thank
was
you.
happy to speak to you.